Hello everyone. I am Dr. Rajesh Verma, endocrinologist, working as associate professor in Department of Medicine. Hypoglycemia, basically, it is a kind of a state in which normal blood glucose level is decreased below the normal reference range. So, in a diabetic patient, a normal blood glucose level is considered in fasting state 70 to 110. So, if the blood glucose level falls below 70, then it is said to have hypoglycemia. So, by current definition, in a diabetic patient, hypoglycemia means low blood glucose that is below 70. And in non-diabetic patient, a typical value of 55 milligram per deciliter is considered as hypoglycemia. So suppose a patient, diabetic patient measures blood glucose and if it is found less than 70, that means patient is having hypoglycemia. And for non-diabetic patients, the cutoff of hypoglycemia is 55. So 70 in diabetic patient and 55 is a cutoff for non-diabetic patient is the cutoff limit for hypoglycemia. There are multiple causes in which the patient can suffer from hypoglycemia. So first in diabetic patient, because in diabetic patient, hypoglycemia is quite common. So if a diabetic patient who is taking anti-diabetic medications as well as insulin or any other combination of anti-diabetic medicines, patient can suffer from hypoglycemia because all anti-diabetic medicine in combination or particularly some class of medicines of anti-diabetics like sulfonylureas or meglitinides or insulin. So they can cause hypoglycemia. So these medicines can cause hypoglycemia, and there are some non-diabetic conditions in which hypoglycemia may be there. So some disease or some neonatal pancreatic conditions which can cause hypoglycemia. Other than diabetic patients, some diseases like chronic kidney disease, chronic heart disease, chronic liver disease, these patients can also suffer from hypoglycemia. There are multiple ways to detect hypoglycemia. First and foremost and most commonly used measure for detecting hypoglycemia is blood glucose monitoring device. So we all commonly know there is a small matchbox size device which measures blood glucose in the capillaries. So if someone wants to measure the blood glucose, then someone has to prick the finger and take out one drop of blood, and this is a capillary blood, and it is to be put on the glucometer device strip, and the device instantly checks the blood glucose levels. So if blood glucose level is found to be less than 70, then patient is suffering from hypoglycemia. So this is the most commonly used and most frequently acceptable method of detecting hypoglycemia. Another method of documenting hypoglycemia is lab measurement. So somebody is having hypoglycemia symptom, then the blood sample can be taken from the vein and it can be sent to the lab. But the lab report comes after some time, say half hour, 30 minutes, 40 minutes or half hour. So there is a lag time between the detection of hypoglycemia and treatment. So recommended protocol is to detect hypoglycemia instantly by a glucometer. Another method of measuring hypoglycemia as well as hyperglycemia is CGMS. CGMS, the full form is CGMS is continuous glucose monitoring system. So as the name itself is suggesting, it is a continuous glucose monitoring device. So there is a matchbox kind of device, and the sensor can be applied over the arms or over the abdomen or over the backside, and it measures the interstitial blood glucose for intermittently every 5 minutes. So it measures intermittently blood glucose every 5 minutes, day and night. So if a patient has applied a continuous glucose monitoring device, then the patient can monitor the blood glucose levels, higher blood glucose levels as well as lower blood glucose levels. But this device should be used in those patients in whom nighttime hypoglycemia is suspected, or if patient is having nighttime hypoglycemia or hypoglycemic unawareness there when the patient is not suffering from any symptoms of hypoglycemia. So in those patients, continuous glucose monitoring can be advised to measure the hypoglycemic episodes. But the common and standard and most recommended method is to measure the glucose by glucometers to detect hypoglycemia. First is symptomatic hypoglycemia. First is symptomatic documented hypoglycemia. Now, what is symptomatic documented hypoglycemia? If the patient is perceiving symptoms of hypoglycemia or symptoms of low blood glucose, and the patient is able to measure the blood glucose, and the patient glucose is found to be less than 70, this is documented symptomatic hypoglycemia. And the second is undocumented. So if the patient is suffering from symptoms of hypoglycemia, but patient has no glucose monitoring device, and patient has taken glucose, and patient has treated himself. So this is a kind of undocumented symptomatic hypoglycemia. So in relative hypoglycemia also, say if one patient is having hyperglycemia for very long time, say 200 or 300 blood glucose level for many days or many months. Now, if this patient suffers from decrease in blood glucose level, but not in the hypoglycemic stage. Suppose a patient was having 300 blood glucose, and now the patient blood glucose is rapidly become down to up to 100. So 100 is not hypoglycemia, but previously the patient was having 300 blood glucose, now it is 100. So this is known as relative hypoglycemia. So some patients suffer from clinical symptom of hypoglycemia at that period of time also. So that is known as relative hypoglycemia. So only blood glucose level, if it is less than 70, needs urgent medical attention as well as treatment. Treatment of hypoglycemia is very important because hypoglycemia is a medical emergency. So if someone is having hypoglycemia, the first thing is to do is measure the blood glucose. If the patient is able to measure the blood glucose, then strictly we advise the patient to take 4 teaspoonful of glucose. If the patient is not having glucose at home, then the patient can take 4 teaspoonful of sugar and immediately mix it with 1 glass of water and immediately take it with that glucose water and wait for 15 minutes. And after 15 minutes, again monitor the blood glucose level. If it is above 70, then it's well and good. And if it is less than 70, then the repeat that glucose injection and consult the nearby doctor for medical attention. Diet has a major impact on prevention of hypoglycemia. So if a patient of diabetes and suffering from recurrent episodes of hypoglycemia or single episodes of significant hypoglycemia, then modification in diet and diet pattern and sleep pattern is very important. So what I advise to my patient is, see, all persons take 3 major meals. First is breakfast, second is lunch, and third is dinner. So the ideal time of taking breakfast is 7 to 8 a.m. or 8 to 9 a.m. So this is time of breakfast, lunch at the time of 1 to 2 p.m. and dinner at the time of 7 to 8 p.m. or 8 to 9 p.m. So these 3 breakfast, lunch and dinner. These are 3 major meals. Now in between 3 major meals, there are 3 minor meals. So say at 11 around, the patient can take a light snacks, milk or some fruits. Then an evening snack taken at 4 or 5 p.m. Some people, they take tea or light snack at evening hours. So that's a evening snack. And one light snack at bedtime, say 1 glass of milk. So 3 major meals and in between 3 minor meals. That makes a complete meal for the diabetic patient who is suffering from frequent episodes of hypoglycemia. So frequent small meals is the key to success in managing hypoglycemic episodes. Exercise has a very large impact on hypoglycemia. So if a diabetes patient is having regular insulin injection or regular medication and regular exercise, if that patient does unaccustomed exercise or excessive exercise, then exercise can lead to low blood glucose level. See, our muscles, whenever we do exercise, our muscles do extra work. These muscles consume extra glucose. So whenever the diabetic patient do excessive exercise, the patient's blood glucose level may go very low. So all patients who are doing excessive exercise, they are recommended to do prior glucose monitoring prior to exercise and after exercise. There are many complications of hypoglycemia. See, our brain uses glucose as the main energy source. So most of the blood glucose lowering symptoms are from the neuroglycopenic symptom, when the brain receives less than normal blood glucose levels. So if the patients remain untreated, if the hypoglycemia remains untreated for a very long time, then the brain cells become progressively dead. So brain cells, there may be permanent brain damage. The patient may suffer from seizure or epilepsy, and there can be mental cloudiness. There can be cognitive dysfunction also, and all these things. And the patient may go into the coma, and this can lead to death as well. So there are severe complications of hypoglycemia.